Hi, my name is Becky Pickett, and today we're talking about the difference between hiring a private caregiver and working with a home care agency. While private caregivers may seem like the cheaper or better option, there are sometimes some major risks that we don't see up front. So let's break them down and see what the real differences are, so you can make a confident and informed decision for you or loved one. First off is cost. With a home care agency, we have insurance where we take the liability and all risk. So if a caregiver is hurt in your home, it comes against our workers' comp insurance or liability insurance instead of them having to file a claim against yours. This is a big idea, particularly if somebody gets hurt. We had a caregiver that actually fell on ice in a client's yard, which we covered. If she had been a private caregiver, she could have filed a claim against your homeowner's insurance, which could have cost some pretty major money, depending on your coverage. Number two, backgrounds and vettings. With a home care agency, especially home helpers, we do background checks, social media checks, DMV checks, we do drug testing, and we do a lot of vetting. That caregiver has been interviewed with at least 3 people. We've gone through some extensive background work to check them out. And we also check their personal and business references. But I think our biggest check is the gut check. Because we're not going to let anybody go into a client's home that we wouldn't let go into our own family member's home. Number 3 is training and quality control. We actually have a nurse on staff that oversees all the training initially and makes sure that quality-wise that the caregiver can do the skills necessary to take care of the client. We have some caregivers that are more experienced than others. Our nurse makes sure that we push the right caregivers to the right clients based on their skill sets. We also do quality control checks where they actually redo some classes every year, and she's always adding new classes. We have a complete training room from a hospital bed to a sit-to-stand to slide boards, so each caregiver can learn any skills that they'd like to learn. A private caregiver may not have the skill set that they appear to have, which can cause a risk factor, and it can be kind of dangerous. Number 4, scheduling and backup support. With a private caregiver, if they are sick, a family member sick, or even a family emergency, the car won't start, all those excuses that we hear every day, then you're stuck. Either your family loved one is not going to get the care they want that day, or you're going to have to call out sick or spend your day with your family member. Where with a home care agency, we have a dedicated scheduler who makes sure that all the clients are covered, and we have people available to back up in case that one of those situations occur, whether sickness, family emergency, car trouble, etc. Number 5, oversight and management. With a private caregiver, you are the supervisor, you're the manager, so if something's not being done correctly, all of that falls back on you. The call outs, etc., then you end up being the manager of that private caregiver. With a home care agency, we have the oversight and the management stuff in place. We have a dedicated executive director and 3 team coaches that work with each client to make sure that the caregiver knows what to do, how to do, and we have random drop-in visits to make sure it's being done correctly. If you'd like to learn more, please give us a call at 864-848-1729 or visit our website at www.homehelpershomecare.com/upstate. We look forward to talking to you soon.